Okay, so let's begin with the class. Yeah. So in continuation with lifestyle disorders, um, today we are going to see uh, joint pain, cervical spondylitis, back pain, knee pain. Okay. Um, yes. So now, joint pain. When we are talking about joint pain, basically, first and foremost, joint is something wherein we have more than two or more than two joints. Okay, two bones. Sorry, more than two bones which are held together or which are binded together with muscle or your muscle, ligament, cartilage, nerves, vessels, okay, and additional soft cushioning kind of material. And also there is synovial fluid in between them. Okay. तो जब हम लोग संधि की बात करते हैं, संधि इज योर जॉइंट, तो जब हम लोग जॉइंट या संधि की बात करते हैं तो वहां पे एक तो है दो हड्डियों से ज्यादा हड्डियां रहती हैं। ओके। और वो दोनों एक दूसरे से जुड़े हुए रहते हैं, आपके माम, सिरा, कंडर, वेसल्स, नर्व्स, मिनिस, कार्टिलेजेस, ऐसी चीजों से वो एक दूसरे से जुड़े हुए रहते हैं, फिर बांधे हुए रहते हैं। ओके। सो इसको हम लोग जॉइंट बोलते हैं। Now, what is joint pain? When there is, you could say, you know, dis uncomfortable, or there is a lot of discomfort or restricted movement, or you could say pain, discomfort, restricted movement, or the movements are restricted or decreased. Even flexing and all is not possible. During that time we call that there is joint pain. हम लोग संधि में दुखता है या फिर संधि में दर्द है, ये कब बोलते हैं? जब आप संधि को या फिर वो पार्ट को ठीक से मूव नहीं कर पाते हो, या फिर बहुत कम मात्रा में उसको आप मूव कर सकते हो, जैसे कि डिक्रीज रेंज या फिर रिस्ट्रिक्टेड रेंज ऑफ मूवमेंट्स हम लोग बोलते हैं, या फिर हल्का सा डिस्कम्फर्ट होता है, स्टिफनेस होता है, डिस्कम्फर्ट होता है, मूवमेंट मूव करने के लिए तकलीफ होती है, फिर दिक्कत होता है, तो फिर उस टाइम पे हम लोग जॉइंट पेन बोलते हैं। वेरी कॉमनली, बहुत कॉमनली वात इन्वॉल्वमेंट रहता है, कंपल्सरीली देयर इज इन्वॉल्वमेंट ऑफ वात। ऑफ कोर्स पित्त एंड कफ आर समटाइम्स इन्वॉल्व्ड, बट मेजॉरिटी और मेजरली वात इन्वॉल्वमेंट इज देयर। ओके। वात हमेशा इस ऐसे चीजों पे वात हमेशा इन्वॉल्व रहता है। कभी कभार बाकी के चीजें मतलब बाकी के दोषा भी इन्वॉल्व हो सकते हैं या नहीं भी हो सकते हैं। ओके। नाउ व्हाट आर द कॉमन कॉजेस और द कॉजेस फॉर joint pain? If at all you're consuming excess amount of in the आहार, अगर आप हम लोग आहार की बात करें, if you are talking about the diet, when we are taking excess amount of okay, amla sorry, your katu tikta kashaya. Okay, when we are taking excess amount of katu tikta kashaya, okay, during this time the vata increases, leading to pain. It could be in the form of stiffness, decreased movement, or swelling, anything it could be. जब हम लोग तो जब हम लोग वात की बात करते हैं या फिर वात के सॉरी, जब हम लोग संधियों में दर्द रहता है या फिर जोड़ों में दर्द रहता है, ये हम लोग कब बोलते हैं? जब बहुत ज्यादा तकलीफ होती है। तो इसके कारण क्या है? आहार जो अगर आप देख लो, या फिर आहार का अगर निमित्त अगर हम लोग देख रहे हैं, फिर निदान हम लोग दे रहे हैं, तो कटु तिक्त कषाय रस के पदार्थ या फिर कटु तिक्त रसाय रस हम लोग जो बहुत मात्रा में कंज्यूम करते हैं, वो बहुत ज्यादा खाते हैं, तब जाके वात बढ़ जाता है, जिसके कारण स्टिफनेस, स्वेलिंग या फिर दर्द रह जाता है। नाउ अपार्ट फ्रॉम दैट, विहारज मतलब आपके एक्टिविटीज एक तो it could be because of the inflammation, infection, trauma, injury, increased uric acid levels in the body, or acid levels in the body, overall acid levels in the body. It could be because of excess wear and tear. Excess wear and tear मतलब बहुत ज्यादा आप जॉइंट्स का इस्तेमाल कर रहे हो, या फिर गलत तरीके से आप इस्तेमाल कर रहे हो, या फिर गलत वे में उसका यूज कर रहे हो, ओवर यूज कर रहे हो, बहुत देर तक खड़ी रहना, बहुत ज्यादा चलना, बहुत ज्यादा जॉइंट्स को यूज करना. अगेन दीज आर ऑल व्हेन यू आर नॉट टेकिंग प्रॉपर केयर. जैसे कि आपका नरिशमेंट लेवल कम है, यू आर टेकिंग डिक्रीज नरिशमेंट, बट द यूसेज ऑफ द tissues and all, or joints and all are overused, especially very commonly in the sports, or people who are involved in physical activities. Okay. Sports activities, or some place, or standing for a long period of time, or nowadays, yeah, we have a lot of yoga instructors, but you are using all this, I mean, like, you're doing, but you're not giving enough attention to your body or your joints. मतलब आप भले ही उनको मतलब बहुत ज्यादा, हद से ज्यादा आप उनका इस्तेमाल कर रहे हो, लेकिन आप उस तरीके से उनका ध्यान नहीं रख रहे हो, या फिर उनका ख्याल नहीं रख रहे हो, जिसके कारण बहुत ज्यादा एक मिनट, जिसके कारण उनका जो नरिशमेंट है, या फिर उनका जो यू नो पोषण है, वो बहुत ज्यादा कम हो रहा है. ओके. इन टर्म्स ऑफ यू आर नॉट टेकिंग प्रॉपर केयर, nourishment as well as internal and external. If at all you are into these activities, it could be in the form of instructors, or it could be in the form of sports person, or it could be in the form of physical activities, then it is very very important that you take care of your health and joints, especially oil massage, abhyanga. Okay. Abhyanga is very very important, or is a must. Okay. Apart from that, there is something called as osteoarthritis, osteoporosis, and osteopenia. Okay. Again, osteoarthritis, osteoporosis, and osteopenia are the stages of the bone. Okay. Stages of the bone degeneration, or you could say जैसे जैसे बोन आपकी जो हड्डियां है, वो बहुत ज्यादा वीक होते जाते हैं, या फिर बहुत ज्यादा घटते जाते हैं, तो उस टाइम पे जो स्टेजेस हम लोग बोलते हैं, उसको ऑस्टियोआर्थराइटिस, ऑस्टियोपोरोसिस और ऑस्टियोपीनिया में हम डिवाइड करते हैं. ऑस्टियोआर्थराइटिस जहाँ पे हल्का सा इंफ्लेमेशन है, और जो बोन का जो मिनरल डेंसिटी है, या फिर बोन मिनरल डेंसिटी हम लोग जो बोलते हैं, बीएमडी, वो जब थोड़ा सा कम हो रहा है, तब आर्थराइटिस के चांसेस हो जाते हैं, फिर आर्थराइटिस हो जाता है. लेकिन अगर इसको आप इग्नोर करोगे, तो और डिग्रेड होके ऑस्टियोपोरोसिस होता है, जहाँ पे जो हड्डियों का जो क्वालिटी, या फिर डेंसनेस है, या फिर जो उसका वेट है, या फिर उसकी जो इंटरनल सेल्स है, वो बहुत ज्यादा हल्के होने लगते हैं. एंड when this is also ignored or not taken care of, then they end up into the osteopenia stage. Now osteopenia is wherein the bones become very brittle, मतलब हड्डियां जो है वो बहुत ज्यादा हल्के हो जाते हैं, आसानी से टूट जाते हैं. अब अगर आप थोड़ा सा जोर से धक्का दे दो, या फिर हल्का सा जर्क दे दो, या तो फिर अब थोड़ा सा भी कुछ भारी वाला अगर आपके ये ऊपर गिर भी गया, तो हड्डियां टूट जाएंगी. वेरी कॉमनली आप ओल्ड एज में जो हिप जॉइंट है, हिप जॉइंट या फिर हिप फ्रैक्चर के बाद सुना होगा. ओके. नाउ the bones have some density or weight, and that we are considering in terms of bone mineral density. Okay. Now bone mineral density shows us the stages or the what your bone condition is, okay, in terms of the mineral levels. So if at all it is decreased and a lot of weakness is there or pain is there, then usually very commonly arthritic or inflammation of the bones is seen. Now after, if at all you ignore it and if it is not taken care of, then we have something called as osteoporosis, where the bones become porous, porous in nature, with decreasing weight and very light in weight. And in the third stage or in the last stage, we have something called as osteopenia, wherein the bones become very brittle, they are very lightweight, they are very brittle, and they are easily breakable. Okay, very commonly we see this condition in old age people, especially in the hip fracture. You see that they just fell in bathroom, then they have hip fracture, or they are going and suddenly they had a jerk and they had hip fracture or hand fracture. Just sudden push or sudden jerk ended up be into fracture. Again, these are all because of the uh, low mineral density of the bones. Okay, now of course, apart from that, sprains, strains, jerks, excess use, all these things. Now coming to back pain. Okay, back pain. Here back is, when we are talking about back, it goes from neck region to the lower region. Yeah. Now, when we are talking about back, that is your spinal cord. The spinal cord has 31 vertebrae in it. Okay, 31 vertebrae, and the curvature of the spine is like yes. Okay, wherein the it is slightly, it is not in a perfect straight line. It is slightly has a slight curvature to that whole spine. Okay, so again the vertebrae are the bones are like this, one above the other, they are arranged one above the other, and they are hollow in between. Okay, they are hollow in between, which is the passage for the bundle of nerves and other vessels passing from the brain. Okay, from the end of the brain there's a bundle of nerves and different vessels and all, which passes through this vertebrae. Okay, which passes through this spinal cord, and wherever they pass, in between, in between the spinal cords, there is a thin space. Okay, thin space with certain which is feasible, or which is there for the branching out. The main branches are coming like this, and then from in between the vertebrae they are branching out and supplying the nerves to the in and around areas. Okay, so this is how the vertebra is, or the spinal cord is. Okay, now in the spinal cord we have seven vertebrae in the neck region, called as cervical region or neck region. We have seven vertebrae, and then after that we have 12 in the thoracic region, that is your chest region. We have 12 vertebrae. Okay, thoracic vertebrae. Hmm. And then we have something called as lumbar region. Again, there are five vertebrae, and then we have something called as your sacrum region. Okay, sacrum is a again, it has five bones, but they are fused together, and it is like this. Okay, which joins, so it is like this, wherein on literally on which you sit, and at the sides it is joined by the hip bones, so it forms a basin kind of thing, or a girdle kind of thing. Okay, and then at the end you have a bone called as coccyx, or the tailbone. So all together are 31 in numbers. Okay, and these are like this. Now yes, this is the anatomy. जो हम लोग वर्टिब्रे बोलते हैं, या फिर रीढ़ की हड्डी जो है, वो एक तो ऐसे सीधे नहीं रहती है, थोड़ा सा उसको हल्का सा कर्व रहता है. ओके, थोड़ा सा मतलब आपके थोरासिक रीजन पे, मतलब या फिर आपके सीने के रीजन, जो पीछे का जो चेस्ट रीजन है, वहां पे वो हल्का सा ऐसे रहता है, फिर बाद में थोड़ा सा डिप्रेशन, फिर बाद में ऐसे. ओके, तो ऐसे एस शेप में रहता है. वर्टिब्रे जो है वो ऐसे रहते हैं, ऐसे रहते हैं, बीच में थोड़ा सा होल रहता है, फिर हॉलो रहता है, फिर साइड में थोड़ा सा टेल ऐसे रहता है. तो ये जो बीच में जो हॉलो स्पेस है, वहां से ब्रेन ब्रेन से जो एंड होता है, नर्व एंडिंग, वो सारा एक बंडल होके ऐसे निकलता है। ओके, तो फिर जब आप ये दो वर्टिब्रे अब जब ऐसे ज्वाइन होता है, तो साइड में थोड़ा स्पेस रहता है जहां पे नर्व जो है वो ब्रांच आउट होके फिर जो इन एंड अराउंड उसके इर्द गिर्द जो भी जगह रहती है वहां पे वो नर्व का सप्लाई करता है। तो ये हो गया आपका एनाटॉमिकल। गर्दन का जो एरिया है वहां पे आपके 7 वर्टिब्रे है। फिर जो सीने का एरिया, दैट इज द थोरासिक, हम लोग जो बोलते हैं थोरासिक जो है वो 12 वर्टिब्रेज है। और उसके नीचे जो हमारा लंबर, हम लोग लो बैक हम लोग बोलते हैं, उसमें 5 वर्टिब्रेज है। और उसके नीचे जो सैक्रम बोलते हैं वो एक बड़ा उसमें भी 5 बोन्स है, लेकिन सारे फ्यूज हो चुके हैं या फिर इकट्ठा हो चुके हैं, तो वो एक बड़ा बोन की तरह दिखता है। तो जो वो ऐसा रहता है जिसपे आप लिटरली बैठते हो, तो वो ऐसे रहता है। फिर यहाँ पे आपका जो कमर का बोन रहता है, जो हम लोग हिप बोन बोलते हैं, वो इधर जॉइंट होके एक बेसिन की तरह या फिर एक कैविटी की तरह फॉर्म करता है, जहाँ पे हम आपके सारे ऑर्गन्स, ऊपर के ऑर्गन्स जो है वो अच्छे से सेट हो जाते हैं। फिर सबसे नीचे छोटा वाला टेल बोन बोलते हैं या फिर कॉक्सिक्स हम लोग बोलते हैं। ओके, तो ये आपका एनाटॉमी हो गया। Now coming to different pains, okay, I'm taking all in one this. Now we will see each मतलब each part जो है वो क्यों दर्द होता है, क्यों, क्या, वो सारी हम लोग चीजें देखते हैं। Now coming to cervical और your neck region, okay, जब हम लोग cervical या neck region बोलते हैं तो very commonly we find there is pain, stiffness, or fusing, decreased movements, or continuous pain. Sometimes the pain radiates in your hands. Okay, the pain from the neck radiates to your hands. Sometimes the pain radiates to the head and you have headache. Sometimes because of the intense pain in the back, because of the discomfort, you have vertigo or giddiness. Apart from that, yes, these are the very common symptoms found. Now, what are the causes for this? What are the causes for cervical spondylitis? First and foremost, very commonly pillows. Okay, okay, wait. हम लोग जब सर्वाइकल, अभी हम लोग हर पार्ट एक अलग अलग और अलग अलग लेंगे। तो सबसे पहले आपका नेक रीजन है। तो नेक रीजन की जब हम लोग बात करते हैं, तो नेक रीजन जो है वो सर्वाइकल रीजन है। तो वहां पे जब दर्द होता है, तो एक तो आपका आप गर्दन नहीं हिला पाते हो, गर्दन में बहुत जोर का तकलीफ रहता है, और एट द सेम टाइम स्टिफनेस रहता है, मतलब आप बिल्कुल भी ऐसे, मतलब ऐसे ही चलते रहते हो। दूसरी चीज, कभी कभार वो दर्द जो है पूरे हाथ में फैल जाता है, जिसकी वजह से झंझनाहट, ऐसे लगता है चींटियां रेंग रही हैं, या फिर बहुत ज्यादा तकलीफ हो रही है, या फिर जब बहुत दर्द बढ़ जाता है तो सर में दर्द होता है, कभी कभार चक्कर आते हैं, ये सारी चीजें होती है। ओके, समटाइम्स इन दी very commonly along when there is cervical spondylitis, you also have a tingling sensation or numbness of your hands, okay, which is radiating kind of. Now we know why it is radiating, because whenever there is clinched nerves, or when the nerves are coming out of the vertebra and they get pinched or clinched, then wherever the nerves are passing, they will cause any kind of pain, tingling, numbness, or stuff like that. तो जब भी कोई भी नर्व जब वर्टिब्रे के बीच में से जा रहा है और अचानक से वर्टिब्रा ऐसे उसको वो नर्व को ऐसे पिंच कर लेता है, फिर उसको फंसा देता है, तो जहां जहां वो नर्व जा रहा है वहां वहां वो दर्द होता है। ओके, तो उसकी वजह से रेडिएटिंग चीजें होती है, रेडिएटिंग पेन वगैरह होता है। नाउ कॉजेस फॉर सर्वाइकल स्पॉन्डिलाइटिस, फर्स्ट एंड फॉरमोस्ट, pillows. We want 2 to 3 pillows, 4 pillows, not good. The position is such that the position is always like this. So when you are taking pillows, you are increasing the position, or you're kind of elevating your neck position, so the position of the vertebrae becomes slightly disturbed. Okay, and it is like you are trying to pull the vertebrae apart. Okay, when there is a pulling of the vertebrae, there is very commonly elongated, lot of space in the between the vertebrae, or the decreased, the space gets decreased, there is hernia, there is slip disc, there is inflammation, there is protruding disc, disc prolapse. In this way you will have a lot of things. Okay, जब आप बहुत ज्यादा तकिया वगैरह लेते हो, तो उसका जो पोजीशन है या फिर उसका जो स्ट्रक्चर है वो चेंज हो जाता है। तो ऐसे लगता है कि जो रीढ़ की हड्डियां है उनको हम लोग ऐसे पकड़ के खींच रहे हैं। तो जब ऐसी चीज होती है तो फिर वेरी कॉमनली हमको वो वर्टिब्रे के बीच में जो स्पेस है वो बहुत ज्यादा बढ़ जाता है, या तो फिर डिस्क प्रोलैप्स होता है। ऐसी बहुत सारी चीजें होती है। नाउ अपार्ट फ्रॉम दैट, नाउ कमिंग टू one is the pillow, the other is the posture, the sitting posture, always in hunched back, drooped shoulders drooping, very hunched back, the posture is not proper. Even when we are sitting, we are not sitting in a straight posture, we are always hunching or drooping. Laptop, again, continuously we are putting our neck down to look at the laptop, or we are continuously looking at our mobiles to your head is dropped. So again, that apart from that, yes, these are very very common. Pillows, one of the major. Sitting posture, one of the major. Laptops, all these things. And apart from that, yes, these are some of the things. Now coming to the chest or the thoracic, in thoracic region, the pain also we find it very less, but even in thoracic, especially the back, here the scapula, you have a bone here, we call this as a scapula bone, very commonly in between the scapula blades. Okay, जो हमारे यहाँ पे पीठ में ना ऊपर के जगह पे आपको एक हड्डी दिखेगी, उसको हम लोग स्कैपुला बोलते हैं। तो ये स्कैपुला, दोनों साइड के जो स्कैपुला है उसके बीच में जो पोर्शन है, वो पोर्शन में बहुत लोगों को तकलीफ होती है, बहुत लोगों को दर्द रहता है। नाउ अगेन दिस इज बिकॉज ऑफ द hunched shoulders or drooping shoulders, or always we are on the, even if we are on the desk, we are always like bending and we are doing things. So these all postural defective postural or wrong postures will increase the stiffness, and the position of the vertebrae and all are changed. Again, posture is one of the biggest. Apart from that, the mattress, the mattress should not be too soft or too runny. It is said that if at all you have pain or disalignment, or your bones, vertebrae are not in alignment, then just sleep on the hard floor. Very very beneficial. Within few days your pain will be gone. In fact, in Ayurveda, one of the best line of treatment, or the first line of treatment for low backache or any kind of back pains, we ask the patient to lie down on the hard wooden board. Okay, hard wooden board which is very plain, we ask them to lie down without any head support. Okay, so this will be a bit difficult in the beginning, but over a period of time it is very very beneficial. Okay, even when you are choosing the mattress, see that it is not completely of foam, or it is completely of very soft material, but it has certain hardness. Okay, certain hardness which is not deforming, or which is not altering your spine shape. Okay, yes, apart from that, in the thoracic, the other reason is excessive workouts, excessive workouts, gymming, weights, heavy weights, all these are putting a lot of pressure. Sudden expansion of the body. Okay, working out without warm-ups, any workouts, any yoga, even if you are doing yoga and all without warm-ups, again this is very commonly found. Now coming to your lumbar region, that is low back. Now when we are talking about low back, very commonly it is the low back, and in that there is hernia, there is disc prolapse, a lot of things. Now again, one of the major reason, the mattress, the bed. The other reason, posture, sitting posture, very commonly. And the third reason, of course, excess weight, overweight, especially during pregnancy and all, side effect of the injections, the lumbosacral spine anesthesia, even that is one of the side effect. But apart from that, majority is because of this posture and your position. Even when you're standing, even when you're standing, you're walking, you are you are very very commonly doing what things, you're not putting the whole of the weight on the whole of the foot. The weight of the body is not equally distributed on the foot. Sometimes we tend to put more weight on the front toes or on the heels or at the sides. Even while standing, if you are standing for the long period of time, first of all, we are wearing very huge heels, okay? And on top of that, we are running, we are walking, we are taking a lot of or we are exploiting our body a lot. Okay, now during this time also, sudden and without posture is very very important, because if at all you don't have a proper posture, the body alignment or the joint alignment or the bone alignment gets disturbed, because of which there is a shift in the space, or there is disturbance in the space, leading to clenching or pinching of the nerves. Now when this happens, very commonly the the lower nerves, which is supplying nerves to the lower legs, leading to that gets clinched, leading to sciatica pain or radiating pain from back to low, thigh pain, leg pain, all these things. Apart from that, again, your tailbones are also not very very painful. Again, long period of sitting, improper posture, improper sitting, improper walking. Apart from that, your bike rides, by riding the bike, very commonly we ride the bike, we don't look at the space, way we are going, all these things are there. So all the pits, pits, digs, holes, or your speed breakers. Yeah, speed breakers, all these are causing. So see that whenever you are going somewhere, if at all it is possible for you to walk, then please keep walking. Walk as much as possible, avoid bike rides as much as possible. But even if at all you are taking bikes, see that you are going on the bike at a leisure, very at a minimal speed, with and avoiding all the hurdles or the pits and stuff like that. And if at all you're going somewhere and you have very small time, see that if at all you're in a hurry, don't use bike. Why? Because when you are in hurry, you are not mindful or conscious about all the hurdles which are in the road. You just blindly, you're looking at the watch and you're looking at the speed, and you're just blindly speeding up, without minding the pits and the bumps and all, which leads to jerky movements, leading to again disturbed alignment or painful backs. Yes, now coming to the tailbone, of course, one of the major reason is the posture, walking and sitting posture and stuff like that, and of course overweight. Now very commonly in the males or in the male genders, we see wallet syndrome. Now what is wallet syndrome? You keep the wallet in your back pocket and then you sit on the bike and you ride. So what happens, one side of the bum of your body touches the seat and the other bum doesn't touches the seat. So where what happens, and on top of that you are jumping, you're riding the bike and you're jumping. So what happens, there's a lot of disbalance or alignment. So whenever you're riding the bike, please make sure that you're not keeping the wallet behind, with the wallet at the back pocket, then sitting on the bike. Please don't do that. What happens, again, even while sitting in the car, driving car and all, see that you're not keeping the wallet in your back pockets and then you're sitting on them. Very very bad. Okay. um yes, I think we have covered all the this. Now coming to the yeah, I think yes, हाँ. Yes. Now we are done with the neck. Now, next joint is the knee joint, major knee joint. Now, again, knee joint is what? Knee joint is when your femur, that is your thigh bone, connects or joins with the leg bone of that are tibia and fibula. Okay, this is your let's say this is your say this is your femur, that is your thigh bone, and these are your leg bone, that is tibia and fibula. And here at the junction, or when these two three bones meet, there is a sort of gap here, and this gap is covered with a triangular kind of bone which is called as kneecap. Okay, ये आपका थाई का बोन है, उसको हम लोग फीमर बोलते हैं, और ये आपके पैर के दो हड्डियां हैं जिनको हम लोग टिबिया फिब्यूला बोलते हैं। फिर इनके ऊपर, मतलब जहां पे ये दोनों जॉइन होते हैं, यहाँ पे एक ट्रायंगल शेप का एक छोटा सा बोन रहता है जिसको हम लोग नी कैप बोलते हैं। ओके, उसको बेसिकली द नेम ऑफ दैट इज पैटेला। ओके, पैटेला, बट इन कॉमन लैंग्वेज इट इज कॉल्ड एज नी कैप। तो ये है आपका नी कैप। तो ये आपका लेग का एनाटॉमी है। Now, what happens because of which you end up having a knee problem, or you could say discomfort in the knee? Yes, apart from that, you have something. Now, this is joined, or this is बाइंडेड, और इसको हर जगह से क्या कवर करता है? वन इज यू हैव अ लॉट ऑफ मसल, वेरी थिन मसल, देन लिगामेंट्स, कार्टिलेजेस, and some meniscus. Okay, meniscus are something wherein they join from the sides. Okay, from upper bone to lower bone, at the sides, this side and this side it joins, and then we have a lot of cartilage and ligaments which bind this bone. Okay, which bind this bone. So here we have a lot of ligaments, lot of cartilages and meniscus additional, so that there's a lot of support, because the upper body weight is being bared by them, or this is the largest weight bearing joint, you could say, where the whole of the upper body is supported, or the whole upper body weight is taken care by this joint, knee joint. Now now what happens? क्या क्या चीजें हो सकती है? First and foremost, because of excess overweight of the body, again there is a lot of pressure and pain. Apart from that, excess walking, standing, wear and tear, jerky movements, all this. Apart from that, inflammation, localized inflammation, synovial fluid, ये joints के बीच में, in between these joints there is something called a synovial fluid. Okay, so even when this ये जो आपका पैटेला है या फिर जो नी कैप है और ये सारे बोन जॉइंट्स है, उसके बीच में ना एक फ्लूइड रहता है जो चिकना चिकना रहता है, हल्का सा चिकना फ्लूइड रहता है, जिसको हम लोग साइनोवियल फ्लूइड बोलते हैं। तो जैसे हम लोग मशीन का स्मूथ मूव होने के लिए जैसे हम लोग तेल डालते हैं ताकि वो स्मूथली मूव कर सके, ठीक उसी तरह हमारे बॉडी में भी जॉइंट्स के बीच में ना हल्का सा तेल रहता है जो एंश्योर करता है, विच एंश्योर्स दैट देयर इज इजी मूवमेंट ऑफ द जॉइंट्स. Now, when this gets dried up or decreased, then there is inflammation. So during this inflammation, there's a lot of friction between the bones, and the bones get depleted. One side of the bone becomes short when compared to the other side of the bone. जब ये साइनोवियल फ्लूइड कम हो जाता है तो फिर बहुत ज्यादा हड्डियां घिसने लगती है एक दूसरे के साथ. तो जब एक दूसरे के साथ घिसने लगते हैं तो एक साइड की जो ऐसे हड्डियां रहती है, ये लिटरली ऐसे ही रहता है. ओके, ऐसे रहता है. तो जब ये बहुत ज्यादा ऐसे घिसते हैं तो घिसने की वजह से क्या होता है, ये साइड की हड्डी या फिर ये साइड की हड्डी या फिर नीचे वाली हड्डी जो रहता है वो घिस घिस के ना हल्का सा घट जाता है, हड्डी घट जाती है. तो ऐसे ऐसे मूव होके फ्रिक्शन हो के ये वाला या फिर ये वाला कोई भी एक साइड, बेस्ड ऑन दैट ये चीज होती है. अगेन एट द सेम टाइम आफ्टर मीनोपॉज, मीनोपॉज होने के बाद, बिकॉज ऑफ द हार्मोन, डिक्रीज्ड हार्मोन्स, द कैल्शियम इनटेक और द कैल्शियम एब्जॉर्प्शन बाय द बोन्स इज डिक्रीज्ड, अगेन लीडिंग टू these all health hazards or this problems. मीनोपॉज के बाद हार्मोनल इम्बैलेंस या फिर हार्मोन बंद होने के कारण कैल्शियम एब्जॉर्प्शन कम हो जाता है, जिसकी वजह से हड्डियां जो है वो वीक हो जाती है, फिर बहुत ज्यादा साइनोवियल फ्लूइड वगैरह है जो वो कम हो जाता है। तो इन सब के कारण नी में प्रॉब्लम हो सकता है कभी कभार, बिकॉज ऑफ एक्सेस इन्फ्लेमेशन देयर इज वाटर रिटेंशन, और बेसिकली वो नी में दे स्वेलिंग इन द नीज, आपका जो घुटना है वो सूज जाता है, फिर उसमें पानी भर जाता है, बहुत ज्यादा दर्द होता है। एंड वेरी कॉमन हील्स, वेरी वेरी कॉमनली हील्स, जब आप ऐसे चलते हो तो आप जैसे हील्स ऐसे डालते हो, जैसे ही आप हील्स डालते हो तो क्या होता है, कभी कभार चलने के टाइम पे ट्विस्ट हो जाता है। तो जब ये ट्विस्ट होता है, ऐसे जब आपका ट्विस्ट होता है तो ये पार्ट जो है वो ऐसे लिटरली ऐसे हो जाता है जर्क की वजह से। तो यहाँ पे जो मिनिस्कस या फिर जो कार्टिलेज होते हैं, उस पे प्रेशर आके वो हम थोड़ा सा टेयर हो जाते हैं या फिर फट जाते हैं। तो उनकी उनके कारण भी आपने ऑब्जर्व किया होगा, अगर थोड़ा सा जर्क हो जाता है या फिर आपका पैर ऐसे मुड़ जाता है तो आपको बहुत ज्यादा दर्द होता है, very commonly at the ye side cave side. Again, this is because of the pressure. Now, whenever we are wearing heels, high heels, what happens while walking, there is more chances of twisting your legs. So when you're twisting your legs, of course your ankle is twisted, but at the same time the leg gets slightly jerked. So there's a lot of pressure at this area where the meniscus and cartilages are binding the bones. Now what happens when this is there, there's a lot of pressure, or the tensile or the elasticity is pulled much more stronger than its capacity, leading to slight tear, okay, slight tear of the cartilage or the meniscus, leading to intense pain. So you might have observed that whenever you're walking and you have a sudden twist of your leg, then you have intense pain at the side of your knee. Okay. Yes, I think I've covered almost all the points. Yes. So yes. So apart from that, anything else? Let's see if I've missed out something. Hmm. Yeah. Again, very commonly, no movement. No movement. Nirupama ji, metatarsal injury in the foot. Again, it is because okay. See, what happens is plantar and heel pains and all. Heels could be one of the ankle joints. Ankle joints, again, we have a lot of bones there. Okay, we have metatarsal, we have calcaneal, we have tibia, fibula, and stuff all that. So and there's because of bone enlargement, that is calcaneal spur. Very commonly calcaneal spur gets enlarged, leading to a lot of pain in the heel, especially in the heel and in the plantar areas. Okay, or if at all your position or the posture, or the weight is not equally distributed among all of your whole of your foot, even then you have specific pain at a specific area. ओके, आपकी जो एडी है, और एडी है जहाँ पे आपका हील है, हमेशा यहाँ पे एक हल्का सा स्पर्म निकल के आता है, बोन कैल्केनियल स्पर्म हम लोग होते हैं, जो कैल्केनियल बोन से हल्का सा प्रोट्रूजन होता है। ओके, तब ये जब ये होता है तो बहुत ज्यादा दब दब के बहुत ज्यादा तकलीफ होती है। एट द सेम टाइम वेरी कॉमनली मेजोरिटीज, आप जब आपका वेट जो है, फॉर एग्जाम्पल अभी मैं खड़ी हूँ तो मैं बहुत देर तक या तो फिर राइट लेग पे अपना वेट डाल रही हूँ, या तो फिर लेफ्ट लेग पे अपना वेट डाल रही हूँ, तो मैं बहुत ज्यादा ये कर रही हूँ। तो एक ही टाइम पे ऐसे ही खड़े रहो तो ठीक बात है, वेर इन कंप्लीट जो आपका वेट है सारे पार्ट ऑफ द बोन, या फिर आप बोलो फुट, all the weight of the foot is equally distributed on the all the foot areas, that is in the toe area, at the side of the foot, and the heel area. So when you're distributing the whole of the weight and standing in the straight line, okay, in the straight line, erect, with your posture properly aligned, all your bones properly aligned, then here you will have no such pain or no such issues. Okay, posture is very very important. Now, um Yes. Now, yeah, how to deal with the pain? Okay. How to deal with the pain? Yesterday we have seen, a lot of things. I'm not going to go in all these things. You can just go through the cervical spondylitis we have done. Shoulder pain, muscle pain we have done. Mm, Rheumatoid arthritis, we'll see. Um, Now, what best you can do? First and foremost thing, yesterday's oil which I have told, pain oil and all those things what I have mentioned, you can very properly use that. All the procedures. The pain oil, the kizzy, all that you can do. Internally we have a lot of medications like kukutanda twak bhasma, then asti shrinkala, lakshadi gugulu, medohara gugulu, mahayogaraj gugulu, yogaraja gugulu. Then we have बृहत वात चिंतामणि रस, चिंतामणि वात चिंतामणि रस, वसंत कुसुमाकर रस, वसंत मालिनी रस, ऐसे बहुत ज्यादा मेडिसिन है. ओके. वेयर इन जो कैल्शियम लेवल है, या फिर कुकुटांड त्वक भस्म, शंख भस्म, प्रवाल पिष्टि, मुक्ता भस्म, all these are calcium rich. Okay, तो calcium absorb भी होता है. If you are taking ayurvedic calcium supplements even for just 3 months, you will see tremendous difference in the pain and all other stuff. Apart from that, in Ayurveda, for all this, we have specific, of course, Panchakarma therapies, wherein Vamana, Virechana, Basti, Nasya, and all are there. But apart from that, we have something called as Bhyantar Chikitsa. Now, what is Bhyantar Chikitsa? Bhyantar Chikitsa is external treatments. Okay, external treatments in terms of, one is the full body massage. Apart from body massage, we have Kizi, that is Patra Potali Sveda. Okay, Patra Potali Sveda, Valuka Sveda. Then we have Shashtika Shali Sveda, Pinda Sveda. Shashtika Shali Pinda Sveda is, we are taking rice, okay, red rice, and then we are boiling it in milk with and decoction, and we are giving massage with this. Very very beneficial, especially for Parkinson's and muscle debility and all. Navra Kizi, it is called as Navra Kizi. Okay. And we have something called as Parisheka is pouring decoction on the whole of the body. Then we have something called as lepa, wherein a specific paste is being applied. Then we have pichu, wherein the oil pad is kept and tied. And then we have Agni Shalaka, Agni Karma, wherein there is a shalaka or instrument which is made up of five metals, which looks like a hammer. From one end it is sharp, and from the other end it is blunt. Okay, and it is triangle in shape, something like triangular in shape. Okay, and this we use to we heat it in the fire, and then we give gentle taps on the specific areas where there's intense pain. Even that is beneficial. Apart from that, we also use jalaukas or leech therapy in when there is intense pain. So in this way, we have a lot of Bahantar Chikitsa, especially any kind of joints pain, knee, especially in the knee. If at all there is any we have such beneficial or very good, even in the low backs, uh, wherein they are advised for surgery, low back pains or hernia, ye wo falana dimkana. Lot of times they are advised for surgery if at all there's a lot of issue in the back. During that time, Ayurveda is also very beneficial. It is very beneficial, especially during that time, or knee replacement. If any knee replacement and all has been advised, just with Ayurvedic treatment, it can be avoided or prevented. You don't have to worry about knee replacement. We have something called as a basti. Now, I'm not talking about the enema or the anal enema and all. Basti is something. Basti is where we are taking the duff. Very commonly, the wheat flour and the black gram flour. Okay, गेहूं का आटा और उड़द का आटे का हम लोग आटा गूंद के लेते हैं. उसमें of course we add some spice, herbs and all, some medicinal herbs and all, and we make a duff out of it. And just show. And this duff, what we are doing is we are keeping it at the affected area. It could be at the back or whole of the spine, just lower back, or the knees, or the heart, or any part of the body where it can be kept. Okay, we are making a well kind of thing. हम लोग कुएं की तरह उसको ऐसे रख के फिर उसको अच्छे से चिपका रहे हैं. फिर हम लोग वो एरिया पे क्या करते हैं, जो तेल है, अगेन वी आर टेकिंग मेडिकेटेड ऑयल्स, different combination based on whatever doshas or prakriti or whatever it is required. And this oil we are warming it up or heating it up, and then we are pouring it at the specific एरिया. ओके, तो फिर ये जो गरम तेल गरम किया है वो हम लोग वो एरिया पे डाल के उसको रिटेन कर रहे हैं. ओके, वी आर लिविंग इट लाइक दैट ओनली, एंड वी आर मेंटेनिंग द टेम्परेचर. जैसे ही वो तेल थोड़ा सा ठंडा हो जाएगा तो फिर वापस उसको निकाल के हम लोग वे वापस गरम तेल डाल रहे हैं, या फिर उसी में थोड़ा सा गरम तेल ऐड करके ऐसे निकाल के डाल रहे हैं. This is called as the basti. It could be the manya basti, it could be the kati basti. Manya is your neck, kati is your back. Okay, janu basti, that is your knee. Okay, knee ko hum log janu basti bolte hain. Or it could be your netra basti. Okay, or netra akshi tarpana, what we call, to the eyes, or rud basti, that is in the heart region. Okay, in this way we are doing this. Now after this we do it for almost minimum of 8 days. Okay, and after we I mean, like, once we remove the oil, okay, we take out that atta and then we gently massage it. Okay, after massage we give potali sweda or patra pinda potali sweda, navrakizi, or whatever it is. And after this we give parisheka as well. Parisheka is wherein we are pouring hot decoction of specific herbs. We are taking multiple herbs, and then we are boiling it, preparing a decoction, and with that decoction we are pouring it on the affected area. Now when after this again, it could be like, we are applying the lape or the paste or herbal paste, or we are applying oil pads. We are dipping pads in the oil, cotton pads in the oil, and where we are keeping it, and then we are tying it. Or we are putting your leaves. We are applying the lape, and then we are putting leaves on that, and then we are tying. So in this way we have multiple ways or multiple procedures which are so beneficial and so effective that the person who has been advised for knee replacement or surgery of the spine will not have to go further. Okay, after this treatment, of course, internal medications have to be given. Okay, only with this they they don't need to go to surgery or knee replacement, and they can do their work very easily without any this. And the span or the life of the knee or the joints increases by couple of years. Okay, so yearly if they are doing, well and good. But if they are doing this once and then they are applying oil every day, very good. Okay, so in this way it is so beneficial. Internally we have a lot of medications, herbs, spices and all, which are so helpful that it decreases all this. Yes. Now coming to rheumatoid arthritis, amavata, again we have vamana, virechana, basti, nasya, and lepa, pariseka, all these things can be done in this. Okay, very, very beneficial. Yeah. Now you have something called as do and don'ts. What you can do is, like, in this also everyday massage and all, and the pain oil can be used, and then whatever has been told, that can be continued. um yes. Now coming to sandivata. Sandivata is again osteoarthritis, when the pain is shifting kind of pain, or at multiple joints. तो ये जो संधिवात है, ये बहुत सारा शिफ्टिंग एक जॉइंट से दूसरे जॉइंट में जा सकता है, या तो फिर बहुत ज्यादा जॉइंट्स में एक साथ इकट्ठा हो सकता है। यहाँ पे भी डिक्रीज मूवमेंट, स्वेलिंग, स्टिफनेस, वो सारी चीजें हैं। तो यहाँ पे आप अगेन जो भी हम लोगों ने जो भी पेन ऑयल बोला है, जो भी चीजें बोली है, वो आप कर सकते हो, बहुत ज्यादा इफेक्ट होता है। at the same time, one of the best thing to do is just after the oil application, if at all even you can't do oil, just massage your body with sesame oil। तिल तेल से आप बॉडी मसाज कर लो, और गर्म पानी में नमक डाल के वो पानी से आप नहा लो। ओके, after the body massage with sesame oil, okay, if at all you can't use any other oils, just plain sesame oil, body massage your body with that, then take hot water bath which is having salt in it. So in the bucket you can put salt and then take a bath with that. Okay, that is also very relaxing. Even if you can't take salt water bath, then take a tub, add salt to it, hot water and salt to it, and then in that tub keep your legs and sit for a while। ओके अगर आपको नहा भी नहीं पा रहे हो, तो फिर गर्म पानी का एक टब लो, उसमें नमक डालो, और फिर आपके पैर उसमें रख के आप बैठ जाओ। ओके, तो उससे भी बहुत ज्यादा रिलैक्स होता है। नाउ कमिंग टू वात रक्त और gouty arthritis, वेरी कॉमनली gouty arthritis स्टार्ट्स फ्रॉम दी ग्रेटर टो और लेग, मतलब आपका जो पैर का जो अंगूठा है, वहां से gouty arthritis या फिर वात रक्त शुरू हो जाता है, जहाँ पे जो अंगूठा है वो बहुत ज्यादा सूजन वो सूज जाता है। ओके, जब ये सूज जाता है तो इससे क्या होता है, ये फिर शिफ्ट होते रहता है, या तो फिर वो घुटनों में आएगा, या तो फिर हाथ में आएगा, हाथ से उंगली से शुरू होके फिर कोनी में जाएगा, ऐसे हो जाता है। द gouty arthritis starts with the greater toe of the leg, and then it shifts to the knee joint। Okay, in the hand, sometimes even in the hand, in the wrist, and in the elbow it can be seen। Okay, here the joints become very big, stiff, water water retention, they are very tender, hot and red। ओके, जो जॉइंट्स है ये सूज जाते हैं, पानी बहुत ज्यादा रहता है, और गर्म बहुत ज्यादा हो जाता है, और लाल हो जाता है, बहुत ज्यादा लाल हो जाता है। ओके, तो ये जो है ये जो है, इसकी वजह से बहुत ज्यादा तकलीफ होती है। तो यहाँ पे हम लोग ज्यादा से ज्यादा जो डिकॉक्शन रहता है, हल्का सा मसाज, ऑयल मसाज करके वी गिव डिकॉक्शन बाथ। ओके, टू दैट अफेक्टेड एरिया वी pour a lot of hot decoction, and then we apply लेप और पिच्चू। ओके, पिच्चू kind of, and then your कॉटन पैड डिप्ड इन ऑयल। पहले हम लोग उसको तेल से हल्का सा मालिश करते हैं, फिर बाद में जो डिकॉक्शन, परिसे का हम लोग बोलते हैं, जो डिकॉक्शन कषाय जो है, वो गरम गरम कषाय उस पे डालते हैं। उससे क्या होता है, सूजन जो है वो कम होते जाता है, और दर्द भी कम होता है। और उसके बाद हम लोग लेप लगा के फिर पिच्चू लगा के बांध देते हैं। ओके, वेरी कॉमनली, वेरी इफेक्टिव। ओके, yes, these are some of the things। Now yes, very commonly uric acid and gouty arthritis go hand in hand। Okay, it could be in the ankle or the knee, when knee becomes, it becomes so big that we call it as Prostuka, that is it becomes, or it becomes as big as the head of the jackal। Okay, मतलब जो जैकाल है, उसका, उसके सर की तरह वो इतना बड़ा हो जाता है घुटना आपका, तो उसमें गाउटी आर्थराइटिस है। यूरिक एसिड हाई होने की वजह से किडनी डिसफंक्शंस, स्पेशली व्हेन योर किडनीज आर नॉट फंक्शनिंग प्रॉपरली। पिच्छू क्या है मैम? पिच्छू इज जो कॉटन पैड रहता है, कॉटन का पैड लेते हैं, फिर बाद में उसको हम लोग तेल में डुबो के फिर बाद में वो अफेक्टेड एरिया पे रखते हैं, इसको हम लोग पिच्छू बोलते हैं। ओके, so as I was telling, uric acid and gouty arthritis go hand in hand। When the kidneys are not functioning properly, your urea, creat, and uric acid shoots up, and this leads to a increased inflammation in the body, and at the same time, swelling or gouty arthritis in the body. Okay, very commonly the best is methi, saunf, fennel seeds, fenugreek seeds, then your karela, that is your bitter gourd, neem, okay, neem leaves, then yava, that is barley, and buttermilk. Okay, these all are very, very beneficial, and coconut, tender coconut water, of course, and of course your sugarcane juice, even the sugarcane juice, when you consume this in more quantity, then it helps in flushing out your kidneys. At the same time, the uric acid level comes down. Okay. Home remedies you have, I'm not going into that. Now coming to migraine. Now migraine could be because of the food, if any kind of food, it could be amla lavana, madhur amla lavana. In some people, if they eat lot of sweets, they end up with migraine. In some people, if they eat lot of spicy food, they end up with having migraine. Lot of salty food or sour food, khatta, amla, मधुर आम्ल लवण कटु, ये वाले रस के आहार अगर बहुत ज्यादा खाते हैं तो उनको माइग्रेन अटैक होता है. ठीक टाइम से नहीं खा रहे हैं, कभी भी कुछ भी खा रहे हैं, specific food items, in some people Chinese food items causes the Chinese food item causes your trigger in the migraine. Now coming to activities, it could be staying awake in the night, sleeping in the day, too much of hectic schedule. Yeah, going out in the sun, exposing to the flashy lights. Okay, all these are again causing. Now coming to emotions, stress, tension, grief, all these can trigger migraine. Apart from this, hormonal changes, especially before menstruations or after menstruations, before menopause or during menopause, or during the infertility treatment, where testosterone and progesterone hormones are injected, again this increases the migraine attacks. Apart from that, some of the medications and environmental factors like perfume, climatic change, or strong smell and stuff like that, cigarette smoking and all. Common symptoms here, you have intense throbbing headache at the one side of the head. There's a lot of aura, blurred visions, numbness of the body parts, or tingling sensation. Then you have vomiting, nausea, photosensitivity, that is you can't see the light. Yes. Now what you can do, sleep throughout the day. Okay, sleep is the best treatment. Apart from that, this part here where your head ends and your neck starts. Okay, when ends and neck starts, there is a specific depression. Okay, there's a small depression, and in this depression you can apply lavender or rose, just dab lavender or essential oil or rosemary essential oil, and then give a circular movement or a circular massage to that, very gentle circular massage. And after that, keep cold water pad, okay, cold pad, or you could say ice pack to that, very instant relief. At the same time, oil massage also helps a lot. Apart from that, ghee or हाँ जी, तंद्रिमा जी, माइग्रेन में कोई भी वन पार्ट ऑफ द हेड या फिर होल हेड दर्द होता है. ओके, द headaches are not at a specified place. It could be in any part of the head, but for some people it is at a specific part of the head. Okay. Yes. Now anyway, here you have to see that you're away from the causative factors. Okay, what is causing, you have to be away from them. Apart from that, meditation, breathing exercise, pranayama is very, very beneficial. Okay. Mm, yes. Now coming to leukoderma. Leukoderma is vitiligo. Okay, vitiligo. Here, our skin has a pigment called as melanin. Okay. Now this melanin is reason for having wheatish to darker skins. The more the melanin, the darker the skin is. Okay. जो मेलानिन बोल के एक पिगमेंट रहता है जो हमारे स्किन में रहता है, तो वो जितना ज्यादा है उतना रंग सावला पड़ता है, और वो जितना कम रहता है उतना गोरापन ज्यादा होता है. ओके. लेकिन जब विटिलिगो या फिर ल्यूकोडर्मा की बात आती है तो मेलानिन बिल्कुल भी नहीं होता है, जिसके कारण स्किन जो है वो एकदम पूरा सफेद पड़ जाता है. ओके. Again, vitiligo is where the skin doesn't have melanin pigment at all, leading to whitish discoloration of the skin, hair, face, eyebrows, eyelashes, and all those things. At the same time, the cause for this is, of course, one is the diet, hereditary diet, wherein you are consuming a lot of, madhuramla lavana katu rasa in excess form. Okay. And in Ayurveda, there is mention of, even if at all it is Purva Janma Krita Karma. Okay, if at all your previous life karmas, because of that also you end up with vitiligo. That is Shwitra. Shwitra usko bolte hain. That is what it has been mentioned in Ayurveda. Now, some of the home remedies here they have given. Apart from that, Pippali. Pippali is your Piper longum. Okay, just take Piper longum, add rub it, or you could say rub it on the stone, and with this paste, make this paste with mustard oil and apply it on the affected part. Very, very beneficial in stimulating the your melanin. You can also do the same with pepper. Okay, but you see that you're not using powder, but you're rubbing it. Okay, this is one thing. Apart from that, turmeric powder, burn the turmeric powder and add to that mustard oil, and then apply. You can add a little bit of mustard oil and also castor oil to that and apply it. Very, very beneficial. One more thing is your walnuts. Take couple of walnuts, burn it on the gas, directly keep it on the gas, and when they get burnt, totally burnt, take them and powder them. Okay, powder them very nicely, powder them properly, and to this powder add mustard oil, little bit of mustard oil, little bit of castor oil, and then camellia essential camellia oil, that is again a carrier oil. Camellia oil 2 teaspoons, jojoba oil 2 teaspoons, and 1 ml of turmeric oil, turmeric oil 1 ml. So when you mix all this, okay, and then strain it. The oils you can the essential oil you can put it at the end, but after you put all this oil, strain it. Okay, strain it, and this oil you add you can keep it and you start applying to the affected part. Very, very beneficial, and also it helps in stimulating the melanin. Now here some of the rasaushadhis are there. Vata gajankusha rasa, Mahavata gajankusha, Trailoka chintamani and all. Powders are there, ashwagandha powder, Narasimha powder, and all these things. And oil for external use, Narayana Prasarini, Nakula, Masha, Mahamasha, Vishagarbha, Mahavishagarbha, Amritadi. For calcium sources, we have Lakshadi Gugulu, Shankavati, Moringa, lotus seeds, Shatavari powder, Muktavati, Praval Bhasma we have, then Kukutanda Twak Bhasma we have, okay, all these things. Now, yes, how to pacify or decrease Vata dosha? When the Vata dosha is increased, how to pacify it or how to decrease it? Now, the best way to decrease Vata is in the Ahara Madhura Amla Lavana Rasa to be increased, okay, to be taken in more quantity when compared to other rasa. Apart from that, take timely food, time to time food to be consumed. Then your mal mutra should be properly evacuated. Okay, the food should be at a proper time and in a proper quantity. Apart from that, in the activities, no ratri jagarna, no sleeping in the daytime, no sleeping soon after the food, no excess workout, no excess workouts, excess walking, excess talking, excess laughing, excess uh, working in any way in one stretch. Okay, take rest or wait in between. Emotional wise, no anxiety, no tension, no hyperactivities. Okay, even hyper thinking of the brain. Apart from that, in the panchakarma, you can abhyanga is your body massage, steam, swedana. Okay, body massage with oil body massage and steam, basti, enema. Then yes, pariseka, body decoction, pouring of decoction on the body, that is also very beneficial. Then you have nasya, till tail or cow ghee in the nose, that is also very beneficial. And you can also take castor oil, 1 drop of castor oil. If at all your vata is very high, one drop of castor oil in each nostril is very good. In the hot milk, ghee, drinking of that, hot water, ghee, drink that. Yes, these are some of the things. What is snehana of body? Nayanaji, snehana is your oiling. Okay, oiling internal and external, that is called as snehana. Yeah, and apart from that, yoga, meditation, uh, breathing exercise, pranayama is a compulsory. Pratibhaji, Nirgundi tile massage benefits. It is Nirgundi oil. If you apply, then Vata gets decreases. That's it. There is nothing. It is a good pain killer, or you could say Vata Shamaka. It is best Vata Shamaka. That's it. Uh, yeah, use of aranda oil. If at all you have a lot of constipation and bloating and stuff like that, you can take 1 teaspoon of aranda oil or castor oil every day in the night. Okay, before sleeping. For 15 days, or 15 ml once a week. Okay. Then you have various procedures. Sarvanga Abhyanga, that is full body massage. Basti, Matra Basti, Niroha Basti, the fluids. Sarvanga Dhara, that is full body pouring of decoction. Nasya, nasal, Patra Potali Swedana, that is you are making potali and then giving massage. Shirodhara, Shirobasti, the head treatments. So this completes your topic. Any questions if you have? Okay.
Yeah, good afternoon, ma'am. Actually, you make us understand about in late age we have the oiling is required in our bones. So, what is the preventive measure we can take uh, at home
Preventive measure as in for
for
synovial.
if somebody is getting old, say
Hmm.
56, 57, 58, then
Hmm.
these things is likely to happen with them, no, ma'am? The
Then
oiling
you
is needed in the
yes,
oiling
body
is needed.
massage, compulsory body massage, and a
Body
diet.
massage.
Yeah, and a diet
Oh,
which is rich in see oil is depleting means what? The jalamsha or the moisture in the body or the oil content in the body is decreasing. So how you can
ah,
replenish it? By intake.
intake. Okay, so we should have more of the snigna food, something like that.
Yes, yes, yes,
So it is. We can say it's ghee or oil. What we should have it.
yes. Ghee,
Ghee.
ghee,
Okay. Okay.
milk, all fatty food, fatty food.
Fatty food should be there. Okay. Okay. Fine. Fine. And there is no other way that we can have that oiling. If somebody is facing that problem in the initial stage, then is there any home remedy to
The only body massage is the home remedy, nothing
body
else.
massage? So
Yes,
okay, okay, so it is in I mean to say whole the year we have to do that.
yes.
Okay, okay. And ma'am, you just told about the hills, you know.
Hmm.
Ladies
Hmm.
generally they wear it. So all kind of the hills they have to avoid, or only the pointed or the round one
Of
they
course.
should avoid.
See, when you're wearing heels, there
Hmm.
is chances of twisting.
Yeah, yeah,
There is the pressure is different. Your
yeah.
pressure is completely, not
Hmm.
properly distributed. Then obviously all heels.
Or because some hills are, you know, it's very comfortable. We don't have any problem. Though it's
You don't
hill, but
have
it's very comfortable to have
further.
it.
It might further. It might.
It might. So it we should avoid all kind of the hills. In short, correct?
Yes.
Okay. Thank you, ma'am.
Yes, Nirveji.
हेलो मैम।
हाँ जी.
अच्छा मैम, ये कैल्शियम का आपने कहा था कि कैल्शियम सप्लीमेंट्स लेना चाहिए। जस्ट आई हैड अ क्वेश्चन कि आफ्टर 35 ऑफ इयर्स ऐसा है कि कैल्शियम बनना बंद हो जाता है बॉडी में,
नहीं, ऐसा कुछ
इज इट ट्रू?
नहीं. No.
सो
Only after menopause, the calcium production and absorption decreases. It doesn't stop, it decreases.
ओके, बट it's only after menopause.
Yes.
Okay, so can we take calcium tablets in between if you if I feel
Yes,
that
yes.
there
Yes,
is
yes. You can take.
pain
You can take.
sometimes,
You
we
can take.
can take, right?
Yes, yes.
Okay, okay. And ma'am, just wanted to understand what you said is arthroporosis is just the bone becomes hollow.
Osteoporosis. Yes.
Osteoporosis, okay.
Yes, yes.
Osteoporosis is the
Bones
bone
become
becomes
porous.
hollow, sorry.
Porous. Yes,
Porous.
porous.
So
Porous.
which
Yeah,
means they become
porous.
soft, it means,
Very.
right?
Yes, yes. And then
Okay.
osteopenia is where the bones become very brittle and weak and light.
Okay. Osteopenia is they become brittle and light.
Hmm, hmm.
Okay. And osteoarthritis is wear and
Arthritis
tear.
onset.
Some
Yeah, it is like inflammation of the bones.
It's inflammation of the bones. Okay. Okay. And that is you said rheumatoid is something it's defect,
Autoimmune.
right?
Rheumatoid arthritis is a autoimmune
Rheumated.
disorder. Yeah, autoimmune disorder where the body starts attacking the healthy cells.
Okay. So that means only the joints are in trouble? Arthritis
Majority,
is
yes,
joint
yes,
pain, right?
yes, yes, yes. Arthritis
Okay.
is joint pain.
Okay. 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 So there are 1, 2, 3, 4 types of arthritis, right?
There are many types of arthritis, but
Oh,
here
there are
very
many.
commonly, yes, commonly seen or very commonly found arthritis because of our lifestyle is these are.
Okay. And when we get at very young age, arthritis is the osteoporosis, right? The sometimes
Osteoarthritis.
osteoarthritis when we get at the young age.
Very
Okay.
commonly, everybody has osteoarthritis. Osteoporosis and osteopenia are something which we get at the later age, at the old age, very
Older
commonly.
age.
Yeah.
Okay. And this is something is defect, right? Autoimmune diseases are normally, is it the defects from birth?
Could be, could be. It is usually it could be congenital.
So what is that?
Autoimmune are something which are congenital. Congenital is from birth. They are
From
from
birth.
birth.
Okay.
They could come at a very young age, or they could come at a later age when they have some triggering factors.
Okay. Okay. All right, ma'am. Thank you so much.
Yeah. तंद्रिमा जी, यस, दूध के बाद फिश खाने से ल्यूकोडर्मा होता है और बाकी के स्किन डिसऑर्डर्स भी होते हैं. Can we also add castor oil in our daily food to reduce vata dosha? Harnish ji, castor oil in daily food is not recommended because again it is laxative. So you might end up having diarrhea. Ma'am, is sesame oil common for all doshas? Yes, Nirupama ji. निर्वेदी का हो गया. सुलोचना जी, yes. iPhone जी, if at all the person has OA and his RA is in high range, then we will consider it as RA itself, because OA is osteoarthritis is a part of rheumatoid arthritis. Okay. Sulochana ji, please unmute yourself.
यस मैम।
हाँ जी
मैम मैं ये पूछना चाहती थी कि जैसे आपने बताया कि समटाइम्स बोन्स में फ्यूजन हो जाता है, तो वो
एक मिनट, फ्यूजन आई डिडंट गेट यू। मैंने फ्यूजन की बात नहीं की है
मैम। जब आप वो सर्वाइकल बोन्स बता रहे थे तब बता रहे थे कि बोन्स का फ्यूजन भी हो जाता है कई बार।
नहीं, बोन्स का कोई फ्यूजन नहीं होता है, मैंने वो चीज बोली ही नहीं है। बोन्स फ्यूज नहीं होते हैं, सैक्रम बोल के रहता है जहां पे बोन्स फ्यूज्ड रहते हैं। फ्यूज इन द सेंस वो सारे बोन इकट्ठा हो जाते हैं तो उसको एक ही बोन बनता है। वो हर किसी में वो नेचुरल है, वो वैसे ही रहना चाहिए।
नहीं, लेकिन मैम समटाइम्स ऐसे केसेस भी होते हैं ना जिनमें डॉक्टर्स बोलते हैं भाई आपकी बोन बाम्बू हो गई है, बोन्स में फ्यूजन हो गया है, तो वो क्या एक्स्ट्रा कैल्शियम इनटेक के कारण होता है?
फ्यूजन हो गया है, ये नया सुनने में आया है मुझे इसके बारे में इतना आइडिया नहीं है, सॉरी। या
यस मैम।
यस सुबेंदु जी।
Madam, as per Ayurveda, there is no such medicine. Food is the main medicine.
Who told there is no such medicine? Ayurveda has a lot of medicines.
Lot of medicines means all
everything.
herbal or
Herbal,
like that.
mineral, metal, gem, you name
No,
it, we have
I
it.
am talking, and the medicine like the any chemical like the allopathic medicine, etc. like that.
See,
Not
chemical,
that.
allopathic is man-made.
Yeah,
Okay.
man-made
In
medicine. That's
Ayurveda, yeah, they are synthetic,
yeah,
which are
that
harmful.
I am telling. Yeah.
Yeah. In Ayurveda, we prepare medicines, something called as in the form of syrups, in the form of self-generated alcohols, in the form of churna, tablets, leha, different types of medicines. Even we prepare. The effect are very improved and they don't have any side effect kind of.
Okay, but is there any concept in Ayurveda like surgery?
Of course, we have a branch. Sushruta is the father of surgery. He is
Yeah,
also
yes,
the father
that's
of
sure.
surgery
Yeah.
of modern surgery.
Because during our discussion, I seen you not mentioned any surgery. That's why, because someone has the knee problem, someone has you just mentioned the different remedies, like there are no mentioning any surgery. That's why I am a little bit of curious whether is there any concept of surgery.
We have a separate department called as Shalya Tantra. Shalya Tantra is completely about surgery.
Yeah.
It has every surgery, but when surgery is not required, when जो चीज दवाई से और चीजों से हो सकती है तो सर्जरी की क्यों जरूरत है? जहां पे सर्जरी की जरूरत नहीं है वहां पे भी सर्जरी करना इज नॉट राइट।
ठीक है वो तो ठीक ही है, आप सर्जरी ठीक है, बट सपोज बिकॉज माय मदर हैज द नी प्रॉब्लम, his knee get bent, okay, that's why she is not able to walk properly. The doctor is prescribing the surgery. As per Ayurveda, is it without surgery, is it possible or not?
Yes, I myself have treated many people at the age of 80, 82 who had been advised for knee replacements. For them, with Ayurveda, I have treated. Not only me, I'm just telling you my experience, but in everybody, all the Ayurvedic doctors can treat wherein the person has been advised for knee replacement. That can be reversed, or basically what we are doing is we are सप्लीमेंटिंग और जो भी वहां पे डेफिशिएंसी है उसको हम लोग रिप्लेनिश कर रहे हैं. दैट इज द ओनली लॉजिक. So when we are basically the knees become very weak, the tissues become very old and weak, and they are in the degenerative state. So what we are doing is we are adding medicine or we are increasing the strength. So whenever we are doing these kind of therapies or treatments, we are not only repairing them, we are rejuvenating them, and then we are maintaining them. So along with that, we are also giving internal medication. So we are acting in both the ways, from the external and
Okay. That is now if I want your advice related to my mother case, how can I get
you just contact the coordinator. Okay, she will guide you.
Okay, thank you.
Yeah. Yes, Kayan ji.
मैम मेरा क्वेश्चन है कि मैंने ना कुछ साल पहले मेरे को ऐसे बैक पेन बहुत ज्यादा हो रही थी, तो मैंने जब एक्सरे कराया तो जो मेरे वर्टिब्रे थे जो लास्ट वाले टेल बोन के पास होते हैं, दे वर फ्यूज्ड. वो उनके बीच में जो स्पेस होती है उनके बीच में स्पेस नहीं थी. वो कहता है कि जिनके बीच की स्पेस होनी चाहिए, वर्टिब्रे के बीच में जो स्पेस होती है इनके बीच में वो स्पेस नहीं है अब, तो इसकी वजह से आपको पेन हो रही है. तो मैंने डॉक्टर को दिखाया, तो पहले तो उसने मेरे को बहुत ज्यादा डरा दिया कि आपको तो बेड रेस्ट की जरूरत है, ये है वो है. फिर आफ्टर सम टाइम जब मैं दोबारा गई इसके पास, तो वो कहता है कि आपको ये बाय बर्थ ही है, तो घबराने की बात नहीं है. अनटिल और अनलेस आपको थाई और हिप में कोई पेन नहीं हो रही है, तो इट इज गुड, इट इज ओके. तो आई एम फाइन नाउ. तो मैं आपसे पूछना चाहती हूँ, ये होता है बाय बर्थ के लोगों में प्रॉब्लम होती है कि उनके जो बीच में वर्टिब्रे उनके स्पेस ही ना हो बीच में?
हाँ जी, होती है कंजेनाइटल हो जाती है. ओके, उसमें कोई डरने की बात नहीं है. सिर्फ प्रॉपर पोस्चर, प्रॉपर योगा एंड एक्सरसाइज एंड प्रॉपर ऑयलिंग, उससे आपको बहुत ज्यादा राहत मिलती है. ओके,
ऑयलिंग मतलब एक्सटर्नल ऑयलिंग?
एक्सटर्नल मसाज, ऑयल मसाज.
Okay, ma'am. Thank you so much.
Yeah. Okay, so let's end the class here. Okay, meet you tomorrow. Thank you so much.